You went to bed feeling completely fine last night. No chest pain, no dizziness, no warning of any kind. But while you slept, while you were completely unaware, something was happening inside the vessels of your brain. Blood was slowing, pressure was building, and somewhere in the quiet hours between 2 and 5 in the morning, a clot formed. You woke up, but not quite the same. Maybe your arm felt strange. Maybe the words wouldn't come out right. Maybe one side of your face felt different, just slightly, and you told yourself it was nothing. That's how most strokes happen in people over 60. Not with drama, not with warning, with silence. And here's what makes this genuinely alarming. In many of those cases, the stroke wasn't caused by diet or genetics or bad luck. It was caused by the position they slept in. Every single night, for years. I'm Dr. Luca. I've spent decades working with patients whose lives changed overnight, literally overnight, because of sleeping habits they never once questioned. Habits that felt completely natural, safe even. Today, I'm walking you through 9 sleeping habits that silently damage your brain while you sleep, and I'll tell you exactly what to do instead, starting tonight. There's one habit in particular, number 7, that I see constantly in people who consider themselves healthy, people who exercise, eat well, take their medication. They have no idea it's quietly raising their stroke risk every single night. Stay with me until we get there. If you're over 60 or you love someone who is, this one matters. Drop a 1 in the comments right now if you're watching. I read every single one. Habit number 1, sleeping flat on your back with no pillow. It feels natural, restful. For a lot of people over 60, it's how they've slept their entire adult lives, sometimes for decades. But here's what changes in the body after 60 that most people are never told. When you lie completely flat, your head sits at exactly the same level as your heart. In a younger body, that's physiologically unremarkable. But as we age, the vessels in our neck and brain gradually lose their elasticity. They stiffen. Blood doesn't drain from the brain as efficiently as it once did. The veins responsible for that drainage now have to work against a circulatory system that's less forgiving than it used to be. The result? Blood moves more slowly through those vessels. It pools, it stagnates. And in the early morning hours, when blood pressure naturally spikes as the body prepares to wake, a clot can form in that sluggish, thickened blood. If that clot finds a narrowed vessel anywhere in the brain, the damage happens before you're even conscious. Frank was 74, retired electrician from Brisbane. Strong man, still building things in his shed on weekends. He'd slept flat on his back without a pillow his entire adult life, an old habit from his footy days. He reckoned it helped his spine. His wife had never thought to question it either. One morning, she found him half awake and confused. He couldn't lift his right arm. His speech was slow, the words coming out wrong. The scan at the PA hospital showed a clot in his left middle cerebral artery, formed, the doctors believed, in the quiet pre-dawn hours while he slept completely flat. Frank's carotid arteries were stiff with age. Blood had pooled and thickened overnight. His sleeping position had created exactly the conditions that clot needed to form. He survived, but his right hand never fully recovered. He told me quietly, sitting in my consulting room about 6 weeks later. Nobody ever mentioned that how I slept could do that. Not once in 74 years. The fix is genuinely simple. Elevate your head between 20 and 30 degrees. 2 firm pillows or a dedicated wedge pillow. That small angle allows gravity to assist venous drainage from the brain, reduces intracranial pressure overnight, and keeps blood circulating more effectively through those stiffened vessels. This isn't about comfort, it's about keeping your brain properly oxygenated through every hour of the night. Do you sleep flat on your back with no pillow? Type flat or elevated in the comments right now. Just that one word. I read all of them. Now, here's where it gets more confronting, because the next habit feels even more natural than sleeping on your back, and the damage it does is more direct. Habit number 2, sleeping face down, the prone position. Face down sleeping feels safe, comfortable, cocooned even. A lot of people find it the only position they can actually drift off in. But face down sleeping is one of the most mechanically dangerous positions for brain circulation after 60. And the reason is straightforward once you understand the anatomy. When you sleep on your stomach, your neck has to rotate sharply to one side, the only way to keep your airway open. That rotation compresses the vertebral arteries. These are the vessels that run along either side of your spine, through the bones of your neck, and carry oxygenated blood to the back of your brain, the region responsible for balance, coordination, and basic consciousness. Research shows that sharp neck rotation in this position can reduce vertebral artery blood flow by more than 40%. In a 35-year-old with flexible, healthy vessels, that's uncomfortable, but the body compensates. In a person over 60 with stiffened, narrowed arteries, reducing blood flow to the back of the brain by 40% for 6 or 7 hours creates precisely the conditions needed for a clot to form. Margaret was 81. Retired schoolteacher from Ballarat, sharp mind, gentle manner, someone who still did the cryptic crossword every morning before breakfast. She'd slept on her stomach her whole life, never caused any obvious problem, until one morning her daughter came to check on her and found her confused, unable to speak clearly, the left side of her body barely responding. The stroke had affected her cerebellum, the part of the brain fed directly by those vertebral arteries. There was no significant heart disease, no atrial fibrillation, no skipped medication. Her arteries had simply been compressed for too many hours, across too many nights, across too many years. The accumulation had finally reached a tipping point. Margaret now walks with a frame. She told me during rehabilitation, "I never connected the two things, how you sleep and what happens to your brain. It just never occurred to me." If you're a stomach sleeper, the single most effective change you can make tonight is to shift to sleeping on your left side with a firm pillow that supports your neck in neutral alignment, not tilted forward, not twisted, straight. It will feel unnatural for the first week. That's normal. Your body will adapt. Your brain will benefit from the first night. Habit number 3, sleeping on your right side with your arm underneath. This is the habit I see most frequently in patients over 60, and the one with the most serious vascular consequences. When you sleep on your right side with your arm wedged underneath your head or pillow, as millions of people do every single night, you're placing sustained, direct pressure on two critical structures, the carotid artery and the subclavian artery. These are the main vessels carrying blood to and from your brain. They're not small vessels with redundant pathways. They're highways, and you're compressing them for 5, 6, 7 hours at a stretch. Compress those vessels consistently, and blood flow slows. It stagnates. It thickens, particularly in the pre-dawn hours when the body is most dehydrated and blood viscosity naturally increases. And when blood pressure surges in the early morning as the body prepares to wake, a clot that's been quietly forming in that compressed, sluggish blood can break away and travel directly upward into the brain. There's also the brachial plexus to consider, the bundle of nerves running through your shoulder and down your arm. When your body weight compresses that bundle for hours, it doesn't just cause the arm numbness most people dismiss as pins and needles. It sends sustained distress signals through your nervous system that can interrupt sleep architecture without you realizing it. You're not getting the deep, restorative sleep cycles your brain needs, night after night. Peter was 72, Vietnam veteran from the Hunter Valley. Still sharp, still active, drove himself everywhere and took no medications. He'd slept on his right side since the military. Same position, same arm underneath the pillow for over 50 years. One morning, his wife found him halfway out of bed, completely unable to move his left leg. No pain, no warning, just suddenly, catastrophically, unable to move. The scan showed a right hemisphere stroke. The neurology team found no elevated cholesterol, no diabetes, no history of smoking. What the vascular ultrasound revealed was significant narrowing of the right carotid artery, narrowing consistent with years of chronic external compression. Blood flow had been reduced night after night until a clot formed and the damage was done. Peter told me, "I thought the arm going numb was just what happened when you got older. I didn't know it was a warning." The solution? Switch to your left side. Keep your arms forward alongside your body, never underneath. Use a contoured pillow that supports your neck without allowing it to tilt or rotate. And note this, sleeping on the left side carries an additional benefit beyond stroke prevention. It reduces pressure on the heart, improves lymphatic drainage, and assists gastric emptying. One change, multiple benefits. Which side do you sleep on? Right, left, back, or stomach? Type it below. Just one word. I want to know. If this is landing for you, comment below, "Protecting my brain." I read every single one. Always. Habit number 4. Sleeping in a recliner. After a hip replacement, back surgery, or a period of significant joint pain, a lot of people migrate from their bed to the recliner. Temporarily, they tell themselves, just until things settle down. And temporary becomes 6 months, then a year, then simply the way things are. Here's the vascular reality of what's happening during those nights. When you sleep upright at 45 to 60 degrees, gravity continuously pulls blood downward, away from your brain, toward your lower limbs. Your legs and hips become a reservoir for slow-moving, pooling blood. In a younger body, the cardiovascular system compensates efficiently. After 60, with blood that's naturally thicker, vessels that are stiffer, and a heart that pumps less forcefully, that pooled blood in the lower limbs sits. It stagnates, and stagnant blood in aging vessels can form clots, deep vein clots that have a direct pathway upward toward the lungs and brain. There's also something called the Barrow reflex, the body's built-in mechanism for regulating blood pressure during sleep. When you're lying flat, your brain and heart communicate efficiently through this reflex to maintain stable pressure through the night. When you're upright, in a recliner, that reflex is compromised. Blood pressure becomes unstable. It fluctuates. And pressure instability in vessels that are already stiffened and narrowed is one of the primary conditions for overnight stroke. Barbara was 77, retired florist from Hobart. She'd moved to the recliner 3 years earlier after a hip reconstruction. Her ankles swelled every day. She felt dizzy and unsteady every morning when she got out of the chair. She'd mentioned the dizziness to her GP and been told it was postural hypotension. Common enough, nothing to worry about. One morning, she couldn't grip her left hand properly. The scan showed a lacuna stroke, a small, deep stroke in the tissue of the brain caused by a clot in one of the tiny perforating vessels. No atrial fibrillation was found, no significant arterial disease. What Barbara had was 3 years of compromised circulation from sleeping in the wrong position night after night. "I thought I was making things easier on myself," she told me. "I had no idea I was making them more dangerous." If back or hip pain is keeping you out of bed, speak to your GP or a physiotherapist about a hospital-grade adjustable bed or a properly designed wedge system that elevates your torso without compressing your hip joints or lower limbs. And if you're spending nights in a recliner, make a point of getting up and moving your legs every few hours, even briefly. Movement is the single most effective way to prevent blood pooling in the lower limbs during sleep. Habit number 5, sleeping with a heavy blanket over your head. Most people who do this don't think of it as a habit. It's just comfort, warmth, blocking out light or noise, something they've done since childhood without ever giving it a second thought. But here's what's happening inside that cocoon over the course of a night. The airspace under a heavy blanket is small. As you breathe, oxygen levels in that space drop. Carbon dioxide, the waste gas you exhale, accumulates around your nose and mouth. You're rebreathing increasingly stale air for hours at a stretch. In a healthy young body, falling oxygen levels trigger an arousal response. You shift, You adjust. You unconsciously move the blanket. After 60, the brain's sensitivity to these signals diminishes. Your arousal threshold rises. You don't wake up and adjust. You continue breathing that stale air, and your blood oxygen quietly drops. Research from sleep medicine has consistently linked even mild nocturnal hypoxia, reduced blood oxygen during sleep, with significantly elevated stroke risk and accelerated cognitive decline in older adults. This isn't only relevant to people with diagnosed sleep apnea. It applies to anyone whose breathing is restricted by their environment or sleeping position. When blood oxygen drops overnight, blood thickens. Platelets become more active. The combination of thick blood and narrow vessels creates exactly the conditions where clots form. Richard was 79, retired postmaster from Launceston. His wife had gently teased him for years about sleeping with the quilt pulled completely over his head, said he looked like a caterpillar every night. He found it settling, dark and quiet and warm. One winter morning, she couldn't wake him. He was breathing but barely responsive. His blood oxygen at the ambulance was dangerously low. The scan at the hospital showed a silent stroke in the deep white matter of his brain. Small but significant. Formed, the treating team believed, during the night in the context of prolonged oxygen restriction. There was no sleep apnea diagnosis, no prior cardiac history, just a heavy quilt pulled over a face for too many nights. If you use blankets for light blocking, switch to a sleep mask. For noise, try earplugs or a white noise device. Keep your face and airways completely clear throughout the night. Your brain requires consistent, uninterrupted oxygen from the moment you fall asleep to the moment you wake. There are no off-peak hours where it can manage with less. Did you sleep with the covers pulled over your face? Type yes always or never thought about it below. Be honest. Habit number 6. Cold room without proper neck support. Cool temperatures genuinely do help most people sleep. The science on that is clear. But there's a meaningful difference between cool and cold. And for people over 60, that difference has vascular consequences that almost nobody talks about. Cold causes vasoconstriction, the narrowing of blood vessels in response to low temperature. In the extremities, this is a normal protective mechanism. But the neck is not an extremity. The neck is where your carotid and vertebral arteries sit close to the surface, the main pipelines supplying oxygenated blood to your brain. When those vessels constrict from cold, blood flow to the brain is reduced. Not dramatically in most cases, but in a body where those vessels are already stiffened and narrowed with age, any additional reduction in flow is significant. Now, combine cold-induced vasoconstriction with a pillow that's too flat, too soft, or positioned in a way that allows your neck to bend forward, chin tucked toward chest or head tilted to one side. That subtle misalignment compresses the very vessels that are already constricted from the temperature. You've just created two simultaneous barriers to brain blood flow. Many people over 60 also have some degree of cervical spondylosis, age-related changes in the bones and discs of the neck spine. When you combine spondylosis with cold-induced vasoconstriction and poor pillow support, the risk of meaningful overnight reduction in cerebral blood flow increases considerably. Loretta was 76, retired nurse from Canberra, someone who understood the body, or believed she did. She slept with the window cracked open year-round, even in Canberra winters. She used a flat pillow that let her neck curl slightly forward. She'd done it for 30 years. She had a brainstem stroke. The brainstem is fed by the vertebral arteries, the vessels that run through the neck and are most vulnerable to both positional compression and cold-induced constriction. Her vascular assessment showed no significant plaque, no cardiac abnormality. The clinical picture pointed clearly to chronic positional and thermal restriction of vertebral artery flow. Loretta is in ongoing rehabilitation. She told me recently, "I knew about diet and exercise and blood pressure. Nobody ever mentioned cold and a bad pillow. I was nervous. I should have known, but nobody taught us this." The optimal sleep temperature for adults over 60 is between 18 and 20 degrees Celsius. Cool enough to promote sleep quality, not cold enough to trigger sustained vasoconstriction. Use layered, breathable bedding so you can adjust through the night rather than relying on a single heavy covering. For your pillow, medium firm, with enough loft to keep your head aligned with your spine, not tilted forward. Not rotated to one side. Your ear, shoulder, and hip should form a straight line when you're on your side. That alignment keeps the vertebral and carotid arteries as unobstructed as possible through the night. Habit number 7. Chronic tossing and turning. This is the habit I mentioned at the start, the one that catches people off guard. Because tossing and turning doesn't feel like a dangerous habit. It feels like a symptom of poor sleep, an inconvenience, not a risk factor. But here's what's actually happening in the brain during those restless nights, and why it matters more than most people realize. Every time you roll sharply, shift your head, adjust your neck, or change position during sleep, you briefly and abruptly alter the blood flow to and from your brain. In a young body with flexible, elastic vessels, that brief alteration is trivial. After 60, with stiffer vessels, slower circulation, and blood that's more viscous overnight, each of those movements creates a short episode of reduced cerebral perfusion, a temporary drop in the pressure that keeps blood flowing through the brain's smallest vessels. Do that dozens of times a night, every night, and you're creating repeated episodes of circulatory instability in the most delicate vascular territory in the body. There's also the hormonal dimension. Fragmented, restless sleep keeps cortisol elevated through the night, rather than allowing the natural overnight decline that healthy sleep produces. Elevated cortisol at night drives blood pressure spikes, and blood pressure spikes in the pre-dawn hours, between 3 and 6 in the morning, are the primary cardiovascular trigger for the majority of strokes that occur during sleep. And then there's what researchers call the glymphatic system, the brain's own overnight waste clearance mechanism. This system, which removes toxic proteins and metabolic waste from brain tissue, only activates meaningfully during deep, sustained, uninterrupted, slow-wave sleep. Chronic restlessness means the glymphatic system never fully runs its cycle. Waste proteins accumulate, vascular inflammation builds over months and years. The long-term consequence is exactly what you'd expect: accelerated cognitive decline and elevated cerebrovascular risk. Nancy was 74. Retired piano teacher from Adelaide. Precise, elegant, still giving lessons from her home studio. Her husband had mentioned for months that she seemed to fidget constantly during the night, rolling from side to side every 10 or 15 minutes. She woke exhausted, despite believing she'd slept for 7 hours. Then came the headaches, then early morning dizziness. Then one night she woke with her right hand numb and her words coming out wrong. The imaging showed a small ischemic stroke. The sleep study conducted during her admission revealed severe sleep fragmentation and intermittent hypoperfusion, temporary drops in brain blood flow that had been occurring during her restless movement cycles. The combination had allowed blood to pool and clot in a neck vessel during one of those movements. Nancy told me during recovery, "I thought waking up tired was just what getting older felt like. I didn't know my brain was sending me a warning every single morning." If you or your partner notice that you're moving constantly during the night, treat it as a medical symptom, not just a comfort issue. Speak to your GP about a sleep study. Look at your evening routine. Late caffeine, alcohol, screen exposure, and irregular sleep times all contribute directly to sleep fragmentation. A body pillow to support your joints can reduce unconscious repositioning, and slow breathing exercises before bed, 4 counts in, hold for 4, 6 counts out, have meaningful evidence behind them for reducing overnight cortisol and improving sleep architecture in older adults. Does your partner say you toss and turn all night, or do you wake up exhausted despite a full night in bed? Type yes or I sleep still below. Habit number 8. skipping your blood pressure or heart medication before bed. I'm going to be direct about this one because the consequences are too serious for softening. Your blood pressure follows a predictable rhythm. It drops during sleep, a phase called nocturnal dipping, and it rises sharply in the early morning as your body prepares to wake. This morning surge in blood pressure, occurring naturally between 4 and 7 a.m., is the single most common cardiovascular trigger for stroke. It's not a coincidence, it's physiology. If you have hypertension, atrial fibrillation, or any other cardiovascular condition, your medication is what controls the amplitude of that morning surge. It smooths the curve. It prevents the spike from reaching levels that stress already narrowed vessels. Miss a dose, even once, and that protective smoothing is gone. Your blood pressure can spike unchecked in the pre-dawn hours. Your vessels, already stiffened with age, face a surge of pressure they're not designed to handle without medication. Blood pools where flow slows, platelets activate, clots form. One missed dose. In some cases, that's genuinely all it takes. Harold was 71, retired electrician from Geelong. Diligent man, walked every morning, ate sensibly, had mild hypertension, managed on a low-dose tablet once daily at bedtime. One evening, he got distracted watching the cricket, forgot his tablet, told himself he'd take double in the morning. His wife found him the next day, unable to speak clearly. One side of his face had changed. The scan showed a moderate ischemic stroke in the left hemisphere, a clot that had formed during the pre-dawn pressure surge, unchecked by the medication he'd skipped. Harold spent 4 months in rehabilitation. His speech returned, largely, but his confidence never fully did. One tablet, he told me. One night. I didn't think one night would matter. Set a daily alarm on your phone. Keep a weekly pill organiser on your bedside table. If you're prone to forgetting, ask your partner to check in. If cost or side effects are causing you to skip doses, talk to your GP. There are always alternatives. This is not negotiable. Your brain relies on that routine every single night. Habit number 9. Going to bed straight after a heavy meal or a drink. The full belly, the glass of wine, the comfortable drowsiness that follows. For a lot of people over 60, this is the evening ritual, the signal that the day is done and rest is coming. But that drowsiness is not the same as restorative sleep. And what's happening in your cardiovascular system during those first hours in bed is worth understanding clearly. After a large meal, particularly one high in fat, salt, or refined carbohydrates, your digestive system makes a significant demand on your blood supply. Blood is redirected from your brain and peripheral tissues toward your gut to fuel digestion. If your cerebral vessels are already narrowed with age, that redistribution can meaningfully reduce brain oxygenation during the first hours of sleep, precisely when you're least able to detect or respond to any consequence. Add alcohol. Alcohol initially dilates blood vessels. That's the warmth, the flushing, the feeling of relaxation. But as the alcohol is metabolized, vessels constrict sharply in rebound. Blood pressure climbs, heart rate becomes irregular in some people. In older adults, this rebound vasoconstriction can trigger arrhythmias and pressure fluctuations that promote overnight clot formation, particularly in the pre-dawn hours when blood is at its thickest and most viscous. Alcohol also significantly disrupts sleep architecture. What feels like deep, restful sleep after a drink is largely suppressed REM, a lighter, more fragmented sleep state. The glymphatic clearance that should be running through the night is impaired. You wake up feeling unrefreshed. Your brain has not recovered the way it should have. Gerald was 72, retired farmer from the Riverina in regional New South Wales. His evening ritual was dinner at 7, a glass of whiskey at 8, bed by past. He'd maintained it for 20 years without apparent consequence. One winter evening, after a large family dinner, a proper country spread, he went to bed as usual. His wife found him unresponsive at 4 in the morning. The scan showed a large ischemic stroke in his frontal lobe. The treating team found no atrial fibrillation, no skipped medication, no prior stroke history. What they found was dehydrated, thickened blood, elevated post-meal triglycerides, and evidence of alcohol rebound vasoconstriction, the exact combination that creates the conditions for overnight clot formation. Gerald survived, but the stroke cost him his speech and large parts of his independence. His wife told me, "We thought we were doing everything right. We had no idea that dinner and a drink could do that." The rule is simple. Leave at least 2 to 3 hours between your last meal and bed. If you drink, do so earlier in the evening, in moderation, and drink water alongside it consistently. The drowsiness that follows alcohol is not your body telling you it's ready for restorative sleep. It's your body managing a metabolic challenge. Do you eat a big dinner right before bed? Type guilty or I leave a gap below. Be honest, I won't judge. Before I give you the complete safe sleep plan, I want you to understand one thing clearly. We talk about stroke as if it's a sudden event, as if it comes from nowhere. But in the vast majority of cases, a stroke during sleep is the end point of a process that has been building quietly for hours, sometimes for weeks or months. Sleep is not a passive state. During sleep, your brain is running complex maintenance cycles. The glymphatic system is clearing metabolic waste, inflammation markers are being regulated, blood pressure is being reset, hormones are being balanced, memory is being consolidated. But sleep is also when your body is most vulnerable to the consequences of what you've done to it during the day and during every previous night. Blood is at its thickest in the pre-dawn hours. Blood pressure surges naturally as cortisol rises to prepare the body for waking. Oxygen saturation is at its lowest. The arousal responses that would alert you to a problem in waking life are suppressed. This is why 70% of strokes occur between midnight and 9 in the morning. Not because something goes wrong in those hours specifically, because those are the hours when the conditions created by years of suboptimal positioning, poor circulation, and disrupted sleep finally reach a tipping point. What you do tonight, the position you sleep in, the temperature you keep your room at, the medication you take or skip, the meal and drink you have beforehand, all of that shapes what happens in those vulnerable pre-dawn hours. And the good news, which I want you to hear clearly, is this. Most of these risk factors are entirely modifiable. Tonight, without medication, without expense, without anything more dramatic than a different pillow and a different position. Here is what safe sleep looks like after 60, every single night. Position. Left side. Head elevated 20 to 30 degrees with a medium firm pillow that holds your neck in neutral alignment. Ear, shoulder, and hip in a straight line. Arms forward alongside your body, never underneath. If you share a bed and find yourself rolling to your right, a body pillow behind your back can help maintain position through the night. Temperature. Between 18 and 20 degrees Celsius. Cool, not cold. Layered, breathable bedding. Not a single heavy covering pulled over your face. Neck support. A pillow with enough firmness to prevent your neck from bending forward or rotating during the night. If you wake with neck stiffness regularly, your pillow isn't doing its job. Medication. Every night. No exceptions. Alarm on your phone. Pill organizer on the bedside table. Non-negotiable. Timing. Last meal at least 2 to 3 hours before bed. Last drink of alcohol at least 3 hours before bed. Water alongside dinner. Water on the bedside table every night. 1 glass before you sleep. Restlessness. If you or your partner notices chronic tossing and turning or regular morning exhaustion despite adequate time in bed, speak to your GP. Ask specifically about a sleep study. Treat it as a symptom, not a given. These are not dramatic interventions. They're small, specific adjustments that align what you do every night with what your brain actually needs to stay healthy through the night. According to Dementia Australia and Health Direct Australia, Sleep quality is one of the most significant modifiable risk factors for stroke and cognitive decline in adults over 60. You have more control over this than you might think. If this video gave you something concrete, something you're going to change tonight, share it with someone you care about. A partner, a sibling, a friend who mentions waking up tired every morning. This information could genuinely change the outcome for someone you love. Like this video so it reaches more people who need it. Subscribe to the channel because protecting your brain health for seniors is what we're here for every single day. And join our community of active seniors right here. A sharper mind starts with one better decision, and tonight is a good place to start. We'll see you tomorrow.